For today, we heard there is a shortage of cosmetic doctors in the Netherlands. In what way are you helping to train more?
Oh yes, that's a very interesting question actually. Thank you for that. There is an enormous demand for enhancing your looks.
Yeah.
People are really looking to look their best, and so instead of just getting a nice haircut and getting nice clothes and putting nice makeup, people are also looking for a little bit more extensive ways to enhance their beauty.
Okay.
So more and more people are trying, a Botox treatment.
Yeah.
Botox used to be really expensive, but nowadays it's much more accessible to a lot of people. So from many different levels of society, people are trying it, and they find that it's safe, and they find that they look really fresh and they look really good, so they want to continue doing it.
Okay.
And that means that there's a lot of demand for cosmetic physicians. And so I have to help. I have started a academy for aesthetic medicine, and I train other doctors. I train colleagues in specific injection techniques, so they can treat their patients in a safe way, and in a way that the patients look good instead of looking like with a frozen face or artificial. Because if you over treat someone, if you inject too much Botox, people are going to look very strange and very unnatural, and I don't like that look. So what I do is I train the doctors to inject a certain amount in a certain place, using the anatomy of the face, to give the person, the patient, the client, I should actually say, a natural look and not an artificial look.
Wow, you are doing a very great job.
And you know what? It's doing something on the outside. Injecting and making somebody look more beautiful. But actually, the reason is the effect that it has on the inside.
Yeah, because, I was drafting this question. I said, oh, Dr. Jani is always talking about enhancing people's outfit and physical. But what about the inside? What about the inside?
Well,
the soul?
If you read on the evidence-based medicine in the medical journals, they researched what it does in psychological tests.
Okay.
And they found out that people that undergo cosmetic medical treatment, they get improvement of quality of life. And that's basically what people are after.
What do you mean?
Well, people more easily approach other people because they feel more secure of themselves.
Okay.
They perform better at their jobs.
Yeah.
And there's a new number of benefits for people that feel that they are beautiful and that they are attractive.
Yeah.
And so they kind of change their way and they become more open to other people.
So that means that when we have some excesses somewhere, it can affect our mood. If I wake up and I think my bust is too big, or I think my tummy is too big, or my nose is beginning to grow bigger than it's supposed to be, it gives you a complex.
Well, you know how it can feel.
And then your job is just to enhance those areas.
If you wake up in the morning and your hair looks really bad, you feel bad.
Exactly.
But if you wake up in the morning and you look in the mirror, and you look rested, and you look fresh, and you look nice, it makes you feel good. And this is exactly what I'm doing too.
So it's a very good opportunity for people out there who have not been appreciating themselves to have the privilege of being appreciated now, and also appreciating themselves by getting the sort of body they want.
Exactly.
Oh, all right. So my next question is, why all of a sudden the people are about JLo? I mean, the surprises or the shoutings about this JLo bottom. How did that aspect of that celebrity's body become such a popular hit, Jani van Loghem? Is that?
Well, yeah, that's actually a very interesting development because now we have the macrolane, and the macrolane is a gel that you can inject, not just in the face but also in the body.
Okay.
And so I've been using it for breast augmentation for a long time.
Yeah.
Well, not very long, but about 2-3 years since it got on the market.
Yeah.
And but now that we know that it's very safe and very easy, the treatment is very easy, people are starting to look at other ways and other indications. So now that they know that we can inject it into the bottom,
yeah.
into the buttocks,
yeah.
It's a very nice and safe way to just reshape and recontour and enhance the look of the bottom. The
yes.
buttocks.
Really?
Yes. And
so, but my question,
yeah.
Dr. Jani, you've not answered it. How come that aspect? How did that aspect of Jennifer Lopez's body become such a popular hit?
I think people want to have a Latin-looking behind like her.
Really?
It looks very sexy.
Okay.
And I guess that people want to look sexy.
So those that have very big backsides, how are they gonna register?
Sorry?
Those who have very big backside.
Yes.
The back, very big buttocks. How are they going to reduce that?
How are they going to reduce them?
Yes. And have the jello system.
Okay. So to reduce them is by aspiring fat. So it's called.
Do you do that also?
It's called yes. It's called liposuction.
Okay.
Or liposculpture. It is a treatment that is actually a surgical treatment. So it does involve a very, very small knife, but it's very pointed, and it's only to make a little opening so the physician can introduce a cannula, which is like a knitting needle kind of thickness, 2 or 3 millimeters, and with that first we can introduce the fluid that makes a fat liquid, and then with another aspiration cannula we can get the liquid fat, take it out.
Wow. Really? So that means it's not just an easy something. It's not just easy, it's a very long process.
Yes.
Oh. So how is a jello backside shaped differently from the normal shape?
Well, she if you look from the side, if she stands from the side, it goes to the back.
Because I was really reading a little bit about this shape, and then I went to the internet and I was just reading through and seeing different shapes of this jello. I said, wow, we've had so many logans from some of these doctors. So please describe jello. Let's hear from you.
Well, what I realize is that people like, especially on the upper side of the bottom, so just below the back, they like to have a little hollow back, and then the ass goes backwards, and it gives a nice Latin kind of look. And then the hips, they don't want them too wide, but they want their bottom to be going backward. So that's the ideal shape of the jello.
Dr. Jani, so those who were born like it doesn't have a hollow, as you were trying to describe it, and then because their own are very pushy, so off and hanging, how would they get the jello?
Well, there's
How would they get it?
The way that I do it is by injecting some extra volume into the top side of the bottom.
Okay.
So that it can just make the sharp curve and going back. And I do that using hyaluronic acid gel, and hyaluronic acid is a filler.
Yes, okay.
So you can inject that underneath the skin, inside the fatty tissue, and it will give extra volume, and it will reshape. You can use it to really sculpture the backside.
Have you done that to several people?
Yes, I did.
And you succeeded?